Hey guys, this is Dr. Scott Leslie. It's a little experiment. I'm going to try to add some, if this all works out, a video compilation of different areas of osteology. And the feedback looks poor and I'm not happy with it. I'm going to throw these in the garbage. But let's talk about the scapula. We have the right scapula here. Well, how do we know this? If you look at this side, this is going to be the medial border of the scapula. Over here would be where the spinous processes are of the thoracic vertebrae. This would be the lateral border of the scapula. We've got this inferior angle of the scapula, superior angle of the scapula, okay, spine of the scapula. If I bring us down a little bit, this is going to be the root of the spine of the scapula, and then as we go laterally, here's the acromion process. Okay, as I tip us kind of posteriorly towards me, this is going to be the superior angle of the scapula, where levator scapula is going to insert into. Okay, down here is our suprascapular notch for the suprascapular nerve, which will feed supraspinatus and infraspinatus. This is going to be the supraspinous fossa, okay, where the supraspinatus, which is the first of the rotator cuff muscles, the sits muscles, is going to originate here. And then the infraspinous fossa, which infraspinatus is going to sit and also be supplied by the supraspinous nerve. Okay. As I turn the scapula, okay, we're going to have the glenoid fossa, okay, which we're going to have the glenoid labrum, which is a piece of fiber cartilage that's going to sit here, which is going to receive the humeral head. We're going to have the supraglenoid tubercle right here, okay, which the long head of the biceps is going to attach to. Okay, we see the acromion process here again. This would be the subacromial space. Okay, if I stick my pen, what I like to try to show you is when I stick my pen here, we're going to have the supraspinatus muscles going to pass underneath the subacromial arch and go to the greater tubercle of the humerus, which I'll show later. Okay, and as I continue to turn, okay, now we're going to get more of a anterior view. Now, this portion of the scapula is going to go up against the rib cage, forming the scapulothoracic joint. Okay. Now, again, it's not a true diarthrodial joint, okay, but it will be kind of a we call it a joint on the rib cage. Okay. This is going to be the subscapular fossa, which subscapularis, which is one of the rotator cuff muscles. Okay, in sits, we have supraspinatus, infraspinatus, teres minor, and subscapularis. So subscapularis is going to be here. This is going to be our internal rotator, which is going to come out and attach to the lesser tubercle, lesser tuberosity of the humerus. Okay, now, again, we're looking at the, the right scapula. Okay, this is going to be the coracoid process. All right, we're going to have pec minor, coracobrachialis, and the small head of the short head of the biceps, that's going to attach to the coracoid process. Okay, again, looking anterior, this is going to be the superior angle of the scapula. So in your tests, if you ever see the coracoid process looking at, we're looking at an anterior view of the scapula. And again, this will be the medial border. Okay, and I'm going to continue to turn us around again. So again, we're looking at the right scapula from the posterior side. And with the spine of the scapula, just a few things to notice. Okay, the trapezius muscle. Okay, the upper trapezius is going to attach more to the acromion and the clavicle. The middle trap is going to attach to or insert into the spine of the scapula. And then the root of the spine of the scapula is going to be for the lower trapezius. Okay. As I kind of tilt down further, we kind of rotate us around. Okay. Here's going to be the acromion process again. The clavicle is coming from the medial side, a little anterior, and it's going to join here with the acromion to form the acromioclavicular joint. And a very important ligament, the acromioclavicular ligament, is going to be there. And we have shoulder separations, which commonly occur in, if someone falling on an outstretched hand will kind of tear here, okay? When we rotate us back again, okay, again, we're on our right scapula, okay? So we're going to have the supraspinatus is going to originate here, infraspinatus and the infraspinous fossa here, teres minor, which is approximately here on the closer to the lateral wall of the scapula, lateral border, of the scapula, and subscapularis will be over here on the anterior side of the scapula, which my pen is hiding behind. So supraspinatus goes from supraspinous fossa to the greater tuberosity. Infraspinatus goes from the infraspinous fossa to the greater tuberosity, or greater tubercle. And teres minor is going from near the lateral border of the scapula to the greater tuberosity. Subscapularis, the last of the rotator cuff muscles, coming from the subscapular fossa here out to the lesser tuberosity. Okay, supraspinatus is going to be an abductor, especially those first 20 degrees. Infraspinatus, teres minor are going to be external rotators, and subscapularis is going to be an internal rotator. Okay, so hopefully that helps. I am going to do my next video on the proximal humeral head. And again, I will edit these videos as we go along if I'm not happy with them. All right, thank you. Have a great day.